If you or your parents are retired or nearing retirement, this video might be exactly what you need. Today, we're going to talk about 10 major steps that are being proposed in 2025 to improve the lives of senior citizens, making retirement more secure, stress-free, and financially stable. Before we jump in, make sure to subscribe to this channel so you never miss an update that can help you or your loved ones live better in retirement. Let's get started. President Trump has made it clear that he wants to make life better for seniors. His strategy is focused on protecting and improving Social Security and Medicare, the backbone of financial and health support for millions of retired Americans. He's consistently promised no cuts to these programs, understanding how crucial they are for everyday survival. Currently, about 27% of all U.S. voters are seniors, and in 2024, 51% of them supported Trump. This makes them a powerful and influential group, and any major political figure simply cannot afford to ignore their needs. But votes aren't the only concern. The economic pressure on seniors is real. Rising inflation has deeply affected fixed incomes, and many older adults are delaying retirement or dipping into savings earlier than planned. That's why one of the biggest ideas being proposed is eliminating taxes on Social Security benefits. Right now, nearly 40% of people pay taxes on their benefits, depending on their total income. Removing those taxes could mean thousands of dollars saved each year, a real game changer for seniors who are just trying to stretch every dollar. However, there's a catch. Taxes collected on Social Security benefits help fund the Social Security Trust. If that tax revenue disappears, it could accelerate the program's projected shortfall, which might lead to benefit cuts as early as 2033, unless new funding sources are found. That's why strengthening the Social Security Trust Fund is a top priority. Some of the proposals on the table include raising the income cap so that people making over $400,000 a year continue to pay into the system, increasing the Social Security tax rate from 6.2% to around 7.5%, which could bring in more revenue, raising the full retirement age from 67 to possibly 69, though this would likely be unpopular. Changing the benefit calculation formula or investing part of the fund in stocks. Both are risky, but could bring higher returns. Means testing, where wealthier seniors receive reduced benefits to preserve funds for those who truly need them. Boosting the economy, so more people pay into Social Security through jobs and growth. Now let's talk about healthcare, which is just as vital. Trump has supported allowing Medicare to negotiate drug prices with pharmaceutical companies, a move that could significantly lower medication costs for seniors. Medicare Advantage plans have also expanded under his watch, now offering benefits like in-home care, transportation to medical appointments, and even relief for family caregivers. Another important goal is to prioritize home care, so seniors don't feel forced to enter nursing homes, especially since the average annual cost of long-term care is now around $117,000. To support unpaid caregivers, there are discussions about giving tax credits and cutting red tape so they can provide better support without unnecessary obstacles. Trump also emphasizes economic stability, and during his first term, the S&P 500 grew by 68%. Strong markets help retirement accounts, and controlling inflation remains crucial because rising prices have already offset recent cost of living adjustments, COLAs, for seniors. Energy independence is also a focus. Reducing energy costs could directly benefit seniors who are living on fixed incomes and feeling the pinch each month. One area that needs urgent attention is customer service at government offices. Several Social Security field offices and federal buildings have had their leases canceled. This means fewer in-person services, longer wait times, and more frustration for seniors trying to get help. Also, phone support services have been cut back, making it even harder to reach real people for help. There's a real opportunity here for the next administration to fix this broken system. The government has recently proposed new dependent care accounts that could support senior care, especially for families with lower income levels. These accounts may also include matched contributions from the government, potentially easing the financial burden on many households. It would be great to hear your opinions about these new plans being reviewed for potential implementation, particularly how they might positively impact the lives and financial stability of older adults this year. Now, shifting focus to a critical issue, the Social Security Administration's website is facing major functionality problems. According to recent reports, the website has crashed repeatedly due to budget cuts affecting its IT department. These technical failures have been linked to ongoing staff reductions, driven by a new administrative team pushing cost-cutting measures even further. Alarmingly, these cuts are hitting essential divisions, including the team responsible for managing the website. Over the past few weeks, the online platform for Social Security services has suffered multiple disruptions. Some outages lasted as long as an entire day, making it nearly impossible for many seniors and disabled users to access crucial information. Even when the website is accessible, many individuals report login issues, missing data, or extremely slow responses. Basic online tasks now often take several attempts to complete, leading to widespread frustration. These complications are further intensified as the administration transitions more services online, while simultaneously slashing personnel from field offices and tech teams. Ironically, as the digital burden increases, the tech staff is being drastically reduced, a move that's causing chaos and limiting access to vital services. The situation is spiraling into a ripple effect. Beneficiaries are struggling with everything from confirming transactions to simply checking benefit amounts. There have even been cases of false notifications claiming that payments weren't processed properly, triggering unnecessary panic among recipients. The root of many of these problems appears to be poorly implemented fraud detection software, which was deployed without adequate testing. As a result, the system could not handle the massive volume of users seeking benefit updates. Since more services have been shifted online, the surge in web traffic has only worsened the situation. One official described it as an overwhelming influx of distressed users trying to verify their financial security. A wide range of individuals are being impacted, from the 7.4 million recipients of supplemental security income to retirees and caregivers of disabled individuals. Many are now experiencing heightened stress, sleepless nights, and confusion over payment accuracy. Field office workers are also overwhelmed, forced to rely on manual paperwork to compensate for system failures, which significantly slows down operations. The real-world consequences of these failures are very concerning. Seniors across the country are unable to make appointments or update emergency contact information due to ongoing technical glitches. Families caring for individuals with disabilities are seeing false benefit alerts, leading to unnecessary emotional distress. Some have resorted to trying multiple browsers, devices, and calling at odd hours, all with no success. Field staff are scrambling to adapt. In some locations, employees have reverted to writing down client details by hand. In other cases, systems that manage scheduled visits have failed completely, forcing teams to distribute paper numbers manually. This entire breakdown is leading to increased wait times, slower services, and rising anxiety about potentially missed payments. Even though no formal reductions in Social Security benefits have been declared, the operational strain is making it harder for the agency to serve its 73 million beneficiaries. As fewer staff members are available, every technical failure multiplies the burden on the remaining workforce. In many cases, a single transaction now requires double or triple the effort. Even basic actions, like checking payment history or updating an address, are now taking several days. For those depending on timely benefit delivery, these delays can have serious consequences. Looking ahead, important changes are coming soon. Starting mid-April, new ID verification processes will be introduced, requiring millions to confirm their identity digitally in order to access benefits. While this is part of a broader effort to tackle fraud, it adds another layer of complexity at a time when the system is already under pressure. Meanwhile, staff reductions continue. Thousands of roles in both customer-facing and back-end technical teams have been eliminated or are under threat. Half of the team responsible for maintaining the agency's online services has already been cut, even as the site continues to handle increasing demand. These cuts are being made in the middle of frequent service outages, some occurring multiple times a week. So what can you do to protect yourself? First, plan your Social Security-related tasks well in advance. What once took a few minutes might now require several days and multiple attempts. Don't wait until the last minute, especially for important deadlines. Second, verify your payments independently. If you're unsure about the status of your Social Security deposits, don't rely solely on the online portal. Check your bank account directly. Sometimes the benefits are deposited even when the website displays inaccurate data. Third, keep detailed records. If you're calling or communicating with the agency, make sure you document everything. This can help prove that you made the effort, even if you weren't able to reach a resolution due to technical or staffing issues. On another important note, let's briefly discuss Medicare. If you're turning 65 or are already enrolled in a Medicare plan, recent developments could affect both your coverage and your expenses. Reports from states like Oregon and Minnesota show that a number of plans are being dropped or going out of network, leaving many seniors without proper coverage. Currently, about 90% of seniors are enrolled in plans that don't fully meet their health or financial needs. The reason? There are over 24,000 Medicare Advantage plans available, and navigating the options without guidance can be confusing and overwhelming. This can lead to lost savings or inadequate medical coverage. Fortunately, there are organizations that provide unbiased help in finding a Medicare plan that fits your specific situation. One such group offers free consultations with licensed advisors, people who don't earn commissions and aren't motivated to sell high-priced plans. Their goal is to help you get the best possible coverage for your needs, potentially saving you an average of $1,100 per year. If you're nearing 65 or are already on Medicare and looking to improve your plan, consider reaching out to such services. They can guide you through the process and make sure you're not among the 90% stuck in a mismatched plan. If you want to keep receiving timely and authentic information about seniors' financial issues, Social Security updates, and Medicare changes, don't forget to subscribe to the channel. Every update will reach you instantly to help you make informed decisions for your future. Thank you.